Okay, so now we're going to start talking about exploring. Now we've gotten through the probing of our entire mouth, and now what we want to do is we want to explore. So exploring is also a part of our assessment instruments. So we're going to use our explorer to detect any hard deposits that are hanging out on the tooth surface, supra and subgingivally. So I'd like you to locate your 1112 Explorer. So it should have these numbers 1112 on them. And then also you'll see that it is has a long, thin working end and a pointed tip. It is going to be double-ended, and it has a mirrored end on the opposite side. So you can kind of see that there. So once you identify your 1112 Explorer, you want to go ahead and place that into your dominant hand. You'll have your mirror in your non-dominant hand. We're going to start in the anterior. So I'm going to just palm my mirror, and then I'm going to utilize my finger to retract the patient's lip. So when we're first thinking about exploring, we have to cut the tooth in half when we look at it, especially starting from the facial surfaces. So if we cut that tooth straight down the middle of that incisor, you're going to have a surface that's towards you, so that this half that's towards you is the towards surface, and then the half of the tooth that's away from you is the away surface. So this is going to determine whether we sit at around 8 or 9 o'clock, or if we sit at 12 o'clock to explore these surfaces. So the first thing that we want to do is we want to identify the correct working end. Because we have mirrored ends, you're going to use one end for certain surfaces and areas of the mouth, and then you're going to use the other end for other areas and surfaces of the mouth. So first, to identify the correct working end, go ahead and place your Explorer into your grasp, and then what you want to do is you want to place it on the tooth. And you want to also make sure that the shank, or this terminal shank, is parallel to the long axis of the tooth. And when you place it on the tooth, if that tip wraps around the tooth or wraps onto the tooth, then that is the correct end. And then what you want to do is change, so switch ends. So I came off the tooth and out of the mouth, switched the end here, and then I'm going to place the other side onto the tooth. And when I put it onto the tooth, the tip points up. So that would tell me that that's the incorrect end, because if I were to try to go into that sulcus, that tip is going to poke that tissue, that patient's tissue. So we want to make sure that we're utilizing the correct end, and that's really the easiest way to determine if we're using, if it's wrapping or not. So when it's wrapping, that is what we want to use. So we're going to be at a 9 o'clock position first. We're going to fly into our tooth right at the midline, because we're only going to be instrumenting these toward surfaces here. So I've established a nice finger rest right on tooth number 7. So I'm going to explore tooth number 8 here. I have a nice modified pen grasp. My position is nice and neutral. So what I'm going to do when I first adapt that to the tooth, what I want to do is I want to only adapt the very tip of the instrument. So there's a side of the instrument that you want to keep on the tooth, and also just about 2 millimeters of that tip. So that's the part of the instrument that's going to stay adapted as you move around in your patient's mouth. So I'm going to go ahead and fly into the midline. I'm going to adapt that tip 2 millimeters, and I'm going to make sure that I've got my nice modified pen grasp, established a nice fulcrum, and then I'm going to go ahead and insert into the sulcus, and I'm going to start initiating this rocking motion. Once I get to that distal line angle, I'm going to start to roll. I have to roll within my grasp, leading with my thumb, so that that tip 2 millimeters stays adapted to the tooth. And as I'm rolling into the interproximal, you will see that the terminal shank will become parallel to that interproximal area. Okay? So we're allowing our instrument, our tip of the Explorer, to slide into the sulcus and go all the way to the base of the sulcus. Stay on that tip 2 millimeters. We're gonna rock, 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 and we're gonna start rolling once we hit that line angle, that distal line angle. And then once we reach that interproximal area, we'll do a little up and down movement or a vertical movement here. And then we will check to make sure that our terminal shank is parallel, okay? So then we can move to tooth number 9. Start at that midline, insert that tip 2 millimeters, rock, 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 rock. Start rolling, rolling, get to that interproximal, do a nice vertical stroke, and then remove your instrument. So you can see that my fulcrum is quite close to where I'm instrumenting. I will probably want to adjust that just a little bit so that I'm not in the line of fire. So if I can instrument maybe one tooth behind or even one tooth in front, that will be helpful. So try to not fulcrum right in the area that you're instrumenting, okay? Okay, so what you want to do is you want to stay at about 8 to 9 o'clock to instrument all of the anterior teeth surfaces toward. So that's starting from tooth number 6 all the way to 11. So to instrument the surfaces away, you're going to need to adjust your position and move to that 12 o'clock clock position. So I'm going to come to the 12 o'clock, and at 12 o'clock, I'm going to still retract with my finger, the lip, and then I'm going to check my end and make sure I have the correct working end. So as I place the instrument tip onto the tooth here, I can see that the tip or the point is pointing up. So that was the side of the instrument that I used for the toward surfaces. So for the away surfaces, I'm going to need to flip my instrument so that I can adapt the correct end. Now that I place the instrument on the tooth surface, it is wrapping, so that tells me I know that that's the correct end here. So I'm at the 12 o'clock position, got a nice neutral position here. I'm gonna begin instrumenting or exploring my away surfaces. So I'm going to explore tooth number 8. I'm going to cut that tooth in half, and then my tip of my instrument will be pointing towards the away surface. So I'm gonna enter at the midline. I'm going to slide into that sulcus, and then I'm going to start rocking on my fulcrum to create that stroke. Your stroke should be about 2 to 3 millimeters long. And then once I hit this midline or this line angle, the line angle, I'm going to start rolling within my grasp. So as I hit that line angle, I'm going to roll, and then I'm pivoting also until we reach that interproximal mesial surface. So let's look at that again. I'm going to go to the midline, adapt the tip 2 millimeters, slide into that sulcus, start rocking, creating these strokes about 2 to 3 millimeters in length. Once I hit that line angle, I'm going to start rolling and also pivoting so that I could keep that tip 2 millimeters adapted to my tooth. Reach that interproximal and do a quick vertical up and down stroke. You'll notice that the terminal shank is parallel to the tooth when you reach that interproximal area. Another example, we'll move to tooth number 9. I've adjusted my fulcrum, going to the away surfaces, fly in, slide into that sulcus, adapt the tip 2 millimeters, start rocking on my fulcrum. I hit that line angle, I'm going to start rolling within my grasp and pivoting my fulcrum. Once I hit that interproximal, create a nice vertical stroke, and my terminal shank should be parallel to the tooth. That's the anterior exploring technique. using toward and away on the maxillary arch. Now looking at the mandibular arch, we can stay here at 12 o'clock and we can do the away surfaces because we know the away surfaces can be done at 12 o'clock. So I'm going to try to adapt my instrument to the facial surface here. And as I adapt my instrument, my tip is pointing up. So that tells me that I'm using the wrong end. I need to switch ends, place that tip on the tooth, and it's wrapping. So that is correct. So I'm going to instrument the away surface here. And you can see my hand, my grasp is kind of coming up. I'm really straight and up on my fulcrum. I'm at that 12 o'clock position. I'm going to fly in at my midline, adapt the tip 2 millimeters. I'm going to start rocking, hit that line angle. I'm going to start rolling and pivoting all the way to the interproximal. I'm going to take a peek at my terminal shank. It is parallel with the tooth. That's the away surface for the lower anterior facial teeth. You can see that technique there. If I want to go into the linguals, I can utilize my mirror for some indirect vision here. If I use that same end and I adapt it to the teeth, my point is pointing out. So that tells me, or pointing up, that tells me it is the incorrect adaptation of that tip. So I'm going to switch my end, adapt the tip, and it's wrapping on the tooth. So that tells me that is the correct end. I'm going to insert at the midline. I'm up on my fulcrum and I'm rocking. Soon as I hit that line angle, which is pretty quick on these little teeth, I'm gonna start rolling within my grasp, leading with my thumb, rocking on my fulcrum, pivoting on my fulcrum. So all of these things are happening simultaneously. Away surface, hit that midline, adapt the tip 2 millimeters, start rocking, rolling as soon as I hit that line angle, pivoting, rolling, rocking as I enter that interproximal, do that nice vertical up and down stroke, and then exit. You'll want to make sure that you maintain a nice light grasp when you're doing this technique. We want to utilize our tactile sensitivity. So if we have a really tight grasp on our instrument, we're not going to be able to feel anything. So just a super light grasp so that you could feel any vibrations coming up through your instrument tip. So now I'm going to go to the mandibular anteriors and probe the facial surfaces. I'm coming back to 9 o'clock for these toward surfaces. I'm going to adapt my instrument, and when I put the tip of my instrument on the tooth, the tip is pointing up, so I know that I need to switch ends. Okay, now I'm wrapping, so I have a nice perfectly adapted instrument. I'm going to adapt the tip 2 millimeters, slide down the midline, and now I'm going to rock and then start rolling as soon as I hit that line angle and cover all these toward surfaces. And then when I reach that interproximal, I'll go up and down. For the left-handed operator, you're going to be at about 3-4 o'clock for these toward surfaces for you. And then your away surfaces are going to be at 12 o'clock. This is the technique for anterior exploring. Please use this video to practice along with your typodont and instruments at home.